The Botanist. And this is a space where we can have both patients, caregivers, and then also members of the public come in if they want to get some more information about medical cannabis. We also have 2 consultation rooms where patients, caregivers, their family members can sit down with our pharmacist on staff, who is the manager of this location, and talk through their unique needs, symptoms they're suffering from, if they have any experience with medical cannabis, and really make sure that they feel comfortable with any products they'd be getting here at The Botanist. So we have those consultation rooms for that. We also have a community resource room, and that's a space that we'll use for presentations from cultivators who would be coming in to do a meet and greet, or when we do food drives or Toys for Tots, there'll be some space in that room. Down the road, we also intend to have other community service kind of initiatives, and that's the space that we can really use in that way, that members of the public, again, can come and visit and see here. We also have a bathroom in the front, waiting area, and then really this is as far as any members of the public can come. Any farther along in the building past these black doors is where you have to be a registered patient or a caregiver to actually enter any farther into the building and see where the actual cannabis is dispensed. So, shall we go? So this is our retail area, and really this space is just designed to be inviting and welcoming to patients both new and old. We have some tables here that have accessories for the consumption of medical cannabis products, as well as some packaging, just so patients can get familiar with how that packaging operates, and we can show them kind of some of the unique child safety features on the products that they may be purchasing. Each vaporizer has different temperature settings depending on what you're looking for. Some terpenes, for example, need to be heated to a higher temperature to activate, whereas others are lower. So here we have a couple plant material vaporizers. And what you would do is you just take a grinder and grind up the plant material and then use this plant material vaporizer to consume it in a compliant method. We have these in these tables here so that when we have a patient that has a question, let's say it's a first-time patient and they really want to get comfortable, we can, show them exactly how the devices work. So very early on when we first open, we'll even be able to do tutorials every 15 minutes with patients to show them, here's where the oven is that you packed your product, here's how you turn the device on, this is what it looks like when it's warming up, how you check the battery, and make sure that not only are they comfortable with the products they're getting, but they're also comfortable with how to use them. Some of these vaporizers also can do extracts, so any medical marijuana concentrates like waxes or oils or shatter can also be consumed in a vaporizer. Some of them are dual purpose, but not all. So over here is where we do have that sample packaging from both cultivators. We have some sample processed products packaging, even transdermal patches, tinctures, edibles. So sometimes patients are just a little surprised at what this packaging looks like. So it gives us a chance to show them exactly how it opens. They can get comfortable, make sure they can open it. And really get familiar with exactly what it is they're going to be coming home with.
So this is just the empty packaging to check out?
Exactly. All right. And also kind of get familiar with what we have.
And what specifically different, what kind of products are we looking at here?
Sure. So in this table we have this is packaging from a cultivator called Buckeye Relief in Eastlake. So this clear one is for their plant material. These are for their edible line. In this case we've got some more plant material cases in the middle, and then on the outside those are both tincture bottles. So that's for a tincture that you'd put underneath your tongue. In this case here, we have more tincture bottles. We have a package from One Origin that their capsules come in. They're the first processor in Ohio that has had capsules for patients to consume medical cannabis. We also have Wellspring Fields, which is a small cultivation and processing facility in Ravenna. Really great family, and they have their concentrate packaging, their flower packaging. They also have some really great edible packaging that's in there as well. Woodward is, this is some more plant material packaging. This is a level 2 cultivator that's actually in Akron. I think they're right down the street from ATCPC on Home Avenue as well. And they're kind of a craft, small batch cannabis company. So this is kind of an example of what their packaging looks like. And then over there you have packaging from Standard Wellness. So here you can see they have packaging for their transdermal patches that actually adhere directly to the skin. also their oils and the syringe that oil comes in, and then their plant material. They've got one of their vaporizer pens, and then also their salve. And there's a jar inside of there that we can kind of show patients so that they know exactly what they're getting. A lot of these people have many questions just because it's the first time. So we try and provide as much information as possible so they know exactly what they're going home with. So over here, we have our seed bar. And really this is an area that if a patient comes into the retail room but really wants to talk through the menu a little bit more, they can sit down and there'll be someone working behind that counter to really help them make selections and talk through the products on the menu and understand.
And you call it the seed bar. Is there actual product coming out on the bar?
So it's like seeds of knowledge, seeds of education. It's something that down the road we also anticipate having initiatives where we have samples of different terpenes, not necessarily that are cannabis products, but just terpenes, linalool, limonene that occur in other botanicals, so they can smell the difference and learn more about the boiling points. Really, our goal at the Botanist is always to be providing as much education as possible, and that's just another station where we can do just that. Back behind the counter over here, you have the POS station. So this is actually where someone is going to purchase their product. Once they've had a chance to talk through what they might like on the menu, they'll come up here and this is where they'll place their order. So once again, their medical ID will get scanned, their photo ID will get scanned, they'll build their order, and then it will go into the system. And actually, the order will virtually go behind the wall here. So our fulfillment works where all of the packaging and labeling of the products and putting in the bag actually happens behind this window. And then when the product is ready, one of these agents will call the patient back up, very much like a traditional pharmacy. And that's when they'll pay for their product and then exit out a separate exit right behind that seed bar over there.
And I'm sure there's a lot of tracking involved in this to make sure the products are all accounted for, and there's probably some magic that happens behind that little window there. So if you could explain what's going on behind the scenes and how you make sure that all the product is accounted for.
Absolutely. So every product that comes into a dispensary is manifested to us through the state's inventory tracking system metric, and it has a product ID and then also a package ID. So not only are we tracking that product ID, which has the testing results tied to it, the product name, the cultivator, the harvest date, all that information on the label, but it also has the individual package that it was a part of. So that you see if there were 160, you know every sale that's coming out of that 160. And that's all information that we put on the label. So we have a label that the dispensary puts on that's just like a pharmacist label. It has the patient's name, their recommending physician's name, the dispensary where it came from, the date that it was dispensed, the time, the volume, which is really helpful even for local law enforcement because that label ensures that the product you're getting was dispensed to this patient and is a actual medical marijuana product that came from a state licensed dispensary. I was going to say, another really great person to talk to more about the process and the tracking and the parallels to the pharmaceutical industry is Emily. Emily is our store manager here. So she is a doctor of pharmacy and will actually be the one responsible for this Botanist location.
Yep.
Emily, could you talk to me about when patients come in, how you determine what their needs are and how you match that with the appropriate amount of product and type of product?
Definitely. So being a pharmacist, we spend tons of time in school learning how to speak with patients and educating them on their medications. So when they come in, a lot of patients are new to cannabis, but they've got lots of traditional pharmaceuticals that they're taking. So we like to sit down with them in the consultation room. We can go over all the medications that they take from their prescriber, and we can make sure that there's not going to be any interactions. Just in a typical pharmacy, we always do drug-drug interaction checks if a patient has a new medication on board. So it would be the same in this situation. Making sure that the medical cannabis isn't going to cause any issues with the pharmaceuticals that they're currently taking, and making sure that they understand what may fit best for their disease state or their qualifying condition.
And I know it's been 11 months in waiting for Summiy County to have a dispensary open. Do you have any sense of what the pent-up demand is in the area? How many clients you're expecting to show up? Have they signed up already? And how do they get in contact with the dispensary to find out what they need?
Sure. So we've been getting a lot of calls here, a lot of emails, and we've been kind of keeping up with those patients, letting them know. I will say, even throughout construction, we'd have a lot of patients here on a regular basis, just asking when you're going to open and wanting something in Summiy County to access their products. So we were able to see that a very large percentage of our patients who are traveling to our Canton location actually are closer to the facility in Akron. I would say it's about maybe a fifth to a quarter of the patients there. So there's obviously been a ton of anticipation for patients in this area, and then also surrounding counties where there isn't dispensaries in that region either. I believe Medina County doesn't have a dispensary, so Akron likely will be one of their closest options, and even I think farther up north as well.
And
So,
can either of you address the pricing on the product right now? I know that till the processing facilities and cultivation centers get up and going full bore, there is some issue with supply and demand. So
sure. Since the program launched, prices have come down, and we anticipate as more and more dispensaries come online and more cultivators come online, that will continue to occur. And you'll see it where the prices in a medical market are getting more closely to what someone would pay in a black market. There's always going to be a slightly higher cost at a dispensary because the product is tested, it's packaged, compliant, you know exactly where it's coming from. So I do expect there will always be a slight increase over what black market prices are, but as more dispensaries come online, that pricing naturally will go down. Even as the botanist, as we have more and more dispensaries, we'll be able to get better pricing by purchasing in bulk and be able to offer that directly to our patients.
and what is the range of pricing for a daily dosage for I think you can purchase a few times a year, correct?
So you have up to a 90-day supply, and depending on your doctor, recommending physician, they will give you up to 3 additional refills, so 3 additional 90-day supplies that would last you a year. In that 90-day supply, it can be a variety of methods. You can purchase plant material, edibles, transdermal patches, and the state has things in the code that specify exactly what that is. We actually give all of our new patients a patient booklet when they first come in to try and explain what that 90-day supply could look like and what those restrictions are. Let's see if I can flip to it easily. So for plant material, for example, it's about 8 ounces. But for, let's say, edibles, it is alternatively 11.7 grams for terminally ill patients and 9.9 grams for normal patients who are not registered as terminally ill. So we use this, and again, when we talk through with the patient, we let them know, here's how many days of your 90-day supply you're purchasing. And that's something they can also check on the Medical Marijuana Control Program's registry website as well. So they can constantly keep track of how that 90-day supply is being allotted.
And I see there's a pretty big distinction between the sativa and indica.
Sure. So we really use this booklet as a tool for our first-time patients to understand, first and foremost, kind of the history of medical cannabis and it coming to Ohio. We talk about how to become a patient, what the qualifying conditions are, just in case they want to share this with others. We also do an overview on the difference between sativas, indicas, and hybrids, and these are all things Emily would talk through in that initial consultation, as well as different cannabinoids, and if they're psychoactive or not psychoactive, things that you can anticipate seeing on the label and how to understand that. We also have some information on terpenes, common terpenes that you see, the aroma in those terpenes. We also had a survey in here about CBD and the difference between CBD dominant or a 1-to-1 or a THC dominant. We've got an overview on delivery methods in Ohio, how long different delivery methods could take for a patient to experience the effects. We have an overview on vaping versus smoking, so vaping being the compliant approved method, smoking being the non-compliant but traditional method of cannabis consumption, to really highlight why it's important that patients are consuming it in a compliant manner, and also how it's better for your health and the overall efficacy of the product. We also have some signs of dependence and abuse and what to do if you recognize any of those signs. Overview on the program, some just kind of patient warnings and guidelines, and then also a section to keep notes and track what works well for you, what you like, what you don't like. And we encourage patients to continually bring this back in with them so that Emily is better able to help them with making choices on their products. And we can recognize patterns in similar potencies or similar terpenes and really help them narrow down exactly what they're looking for. Very early on, I think most patients have to kind of go through a trial and error process to find out what works for them. And so having a guide or a journal of sorts will help speed that process up so they really are only purchasing what's going to best fit their needs.